Thank you. Dr. Bentley, you will get this next question first, and I'll remind you you'll have 2 minutes to give an answer. Given the scarcity of medical services in some areas of the state, the rising costs of health care, and the new federal law expanding access to health coverage, describe how you would approach this issue. Do you support the state's legal challenge of the federal overhaul of health care?
Well, I am totally opposed to the federal government taking over health care. That is absolutely the worst bill that has ever passed the federal Congress. If you want to see what's going to happen in this country, you just wait 10 years down the road when we have no primary care physicians in this state, when it's going to cost businesses and individuals trillions of dollars in taxes that we can't afford, when the elderly in this state will be without health care because they don't have primary care doctors, also because of the fact that there will be rationing of care. When this federal bill is going to cut about $500 billion out of Medicare, how are they going to fund it? It is not a good thing for this country. Now, do we need accessible and affordable health care in Alabama? We absolutely do. And I would ask everyone in the audience and watching on TV to go and look at my website and look at the part that talks about accessible and affordable health care in this country. We can do things on a state level. The thing that's nice about a state is we can be laboratories for change, and we can find out how things work. If they work well in a state, then you can expand it to the entire country. But see, they did not do that. They tried to take over an entire system, and people in this country are not going to like what's going to happen down the road. Now, it's going to be very apropos that possibly a governor of this state, the next governor, is going to be a doctor. Because I understand health care, and I understand how we're going to have to deal with this. So that is one reason that I ask the people out there to vote for me.
Thank you. Commissioner Sparks, you have 2 minutes.
It's pretty obvious this doctor hadn't read the health care bill. The one way that you keep the federal government from taking over health care in Alabama is do what the law says. We have got to pass legislation in Alabama within the next legislative session for our policies and our procedures of how we're going to deal with health care in Alabama. You know, I believe that we need to take the best minds we've got in Alabama, the University of Alabama in Birmingham, the University of South Alabama, the business leaders of Alabama, and we need to find the proposal that fits Alabama. And if there's problems with the health care bill, then let's go change it. But you know, I personally had an experience with people that didn't have opportunities for health care. I had a 42-year-old nephew that fell over dead in a Walmart parking lot because he never had access to affordable health care. I don't believe the people of Alabama want 42-year-old young men falling dead in a Walmart parking lot. I think the people of Alabama wants a governor that will show leadership. Quit pointing fingers at Washington, quit pointing fingers at Montgomery, but do what the law says and make sure it fits the people of Alabama so the federal government don't take over health care in Alabama.
Thank you, Dr. Bentley. You have 1 minute to rebut. And I would remind you, part of the question was, do you support the state's lawsuit that's challenging the new federal law? Well,
not only do I support it, I authored it. House Bill 42 was a bill that I authored. And what it said is that no company, no person, no entity, no health care provider shall be compelled to participate in any health care system. That's House Bill 42. I had that last year. We were able to get it from the Senate down to the House. We were just not able to get it through the House. But it did pass in Missouri, and they voted on in Missouri. And what happened was it passed 71% in Missouri. I think in Alabama it would pass 75%. Now, my opponent talks about his cousin that fell dead in the parking lot at 42. I'm sorry to hear about anybody falling dead at 42 in a parking lot. But I don't think this health care bill had anything to do with that.
Thank you. Commissioner Sparks?
Absolutely it did. He didn't have access to affordable health care, Dr. Bentley. And if you don't have access to affordable health care, those are the things that happen. You know, Alabama needs leadership. And that's what I'm going to provide them. I want to make sure that every student out here, that when they graduate from college, they can stay on their family plan until they get a job. I don't want disaster to hit them within that 2 years so that they go bankrupt before they ever get a job. I want to make sure that these 56,000 small businesses in Alabama can afford health care for their employees. I want to make sure that people who have pre-existing injuries and pre-existing conditions don't get turned away and have to go die somewhere in a corner. I want to make sure that we deal with this law the way we should deal with this law, and that's get the best minds we can in Alabama, pass the best legislation we can so that the federal government don't take our program and run it for us. I'm going to provide that leadership. I'm not going to stand back and scream and yell.
Thank you. Your time is